So my journey began in Toronto 4 years ago when I first joined ASAAP as a program coordinator. So I was the men's outreach coordinator 4 years ago. And then I left for some research work at U of T. And then last year I came back as the executive director. ASAAP started about 30 years ago, or more than 30 years ago, when there was a South Asian queer couple who was not able to access healthcare services, sexual healthcare services, in a language and in a culturally responsible manner as they should have. So it was a very grassroots initiative decades ago when people were like, okay, well, we need these services in a manner that we can consume them, and we started ASAAP. And that was initially to make sure that anyone who's South Asian living with HIV gets the respect, receives the respect, gets all the services that they need in a language that they can understand, and also from that culturally responsible lens. So our support team, I would say, is one of the oldest and the more core work at ASAAP. We work with people who are living with HIV or are affected by HIV or are at risk of HIV. So the support services are primarily for those who are living with HIV or their families or their friends. So those folks who are affected by HIV, maybe not so directly, but indirectly. We run a number of programs within the support program. There's a program for women, there's a program for all folks living with HIV. More recently, we've started support services for Middle Eastern people as well. So anyone who speaks Arabic or Farsi is under the Raha program, which is almost an extension of the support services. So the education team is truly dynamic. We've run a number of programs in the past. We have the men's program with the women's program, and so the education team takes care of condom distribution, outreaching, and providing one-on-one support to people who might be looking for information, let's say on PrEP or PEP, or just getting more information around testing or HIV in general. The education team does a lot of workshops with the community, with other agencies who are looking to gain a better understanding of sexual health. And I'm happy to say that in the past couple of years, we've expanded the education program. While in the past we only had South Asian sexual health focused programs, now we have an Arabic speaking health coordinator, a Farsi speaking health coordinator, and another program for Indo-Caribbean women. So pre-COVID, we ran a number of in-person programs like Cardamom Kitchen, cookouts, in-person outreach at bars, at bathhouses, and obviously that has stopped because of the pandemic. Now what we've had to do is think of ways to transfer all those in-person services to online, and we've done that successfully over the past year. Cardamom Kitchen has become games night or trivia night. Bathhouse outreach has become sessions that are delivered, education sessions that are delivered over Zoom. So we've had to adapt a number of services because of the COVID pandemic, but I'm really happy to say that we haven't really lost touch with any of our community members. We've just been very responsive to their needs and made sure that we don't lose out on those connections that we formed pre-COVID. Yeah, I'm actually really excited about the settlement team. It's a fairly new project funded by IRCC, and under the settlement services, we provide settlement services to newcomers to Canada. We have a Hindi-speaking coordinator, an Arabic-speaking coordinator, and a Farsi-speaking coordinator who ensure that people coming from South Asian countries, from Middle Eastern countries, get the services they need as a newcomer. So we connect them with other agencies to build their language skills, to help them find jobs, to ensure they get the mental, physical health support that they need. And even within ASAAP, so we were talking about support services and education services. So part of our work with settlement is to make sure that these newcomers are connected with the existing programs at ASAAP. The pandemic has really taught us several things. I think we never expected to not be able to meet in person before this. One of the most valuable things about our programming in the past has been that we connected people in person, mostly over food, and that was taken away from us. And once you take that away, at one point we wondered if we will lose connections with our communities. Thankfully, that didn't happen. But it's really taught us that we need to keep thinking of different ways to keep our clients, our community members engaged. And then some of those most vulnerable people might fall through those cracks if we don't ensure that those users are still connected with us. So, if the pandemic is not going anywhere anytime soon, we need to look at a version of services that is perhaps more of a hybrid version, where some of the programming happens in person, but also has the option for people to attend it virtually. Most people will get vaccinated soon. Some people may not. Some people may choose not to. But we need to be mindful of how this pandemic pans out, what our community response is, and at the end of the day, just want to make sure that no one's left behind. Well, hopefully a lot of exciting things. I think there's a lot of there's a lot more we can do with the community, for the community. I think we can expand on our services. We can introduce programs around harm reduction, more one-on-one support. So far, we have to refer people out if they need mental health support. I would love for ASAP to be able to offer mental health services in-house. So I think just capitalizing on what we have, those strong connections with the community, and making sure that we expand on the current services is where ASAP is headed. So harm reduction, mental health, more work with newcomers, more connections outside the province, pan-Canadian, more capacity building, working more closely with other agencies, ensuring that South Asian, Middle Eastern, Indo-Caribbean voices don't get left behind. And also in the past, we've seen that a lot of agencies come to us and say, oh, we work with South Asian people, or we work with Middle Eastern people, or we work with queer people, but we don't necessarily have the capacity to work with these communities. So it might be a South Asian organization that sees queer clients, but they don't know what queer concerns are. Or these are agencies that work with queer people, have South Asian clients, but don't necessarily understand the cultural piece around our identity. So I'm really excited about our most recent project. So we're trying to understand what are the needs of South Asian, Middle Eastern, and Indo-Caribbean queer people across Canada, and how we can identify any gaps in mental, physical, sexual health services that they receive. And how can we fill those gaps? Towards the end of the project, we want to establish a training module for service providers of sexual health, mental health, physical health, who work with South Asian, Middle Eastern, Indo-Caribbean queer clients. And we want to make sure that they have this capacity and an understanding of what it means to work with brown queer clients. So last year in March, everyone was panicking. This pandemic, no one had foreseen it, right? And it was really hard on our most vulnerable, it was really hard on the most vulnerable people within our communities. Thankfully, we have been surviving this pandemic. We've shown that we're resilient, we're strong, and I hope that this resilience stays on, and I hope we can build on this resilience, and I'm very sure we will survive the pandemic and the after effects in the couple of years, and the after effects in the years to come.